A total of 255 Indians have tested positive for COVID-19 in Iran, the government informed the Lok Sabha on Wednesday. Presenting India's preparedness to fight the global pandemic, a written answer from the Minister of State for External Affairs V. Muralidharan said the total number of Indians abroad infected with the virus stood at 276. As per media reports, the 255 Indians were part of a large group of pilgrims from Kargil, Kashmir and Ladakh, who are stranded in the holy city of after India cancelled flights to Iran. Has emerged as the epicenter of the outbreak in Iran, which increased chances of infection among the pilgrims. Also read, efforts on to rescue 300 fishermen stranded in Iran, a complete list of travel advisories issued by the Union Health Ministry. The Hindu had reported that the members of the group had reached out pleading for help and medical attention from the Indian authorities. They alleged that they were not getting adequate official support from the Embassy of India in Tehran. They were without medicines and quarantine facilities, putting the uninfected members of the team at risk. Iran's hospitals, they said, were overrun with domestic patients and unable to get treatment from the hospitals in Also read, fourth batch of 53 Indians evacuated from Iran, Jaishankar. The pilgrims have sought urgent evacuation to India, but New Delhi has declared that only the uninfected will be airlifted. As per unconfirmed reports, the Embassy of India is planning to provide medical assistance to the affected persons in The Supreme Court on Wednesday pulled up the center and telecom companies for doing self-assessment or reassessment of the adjusted gross revenue (AGR) dues fixed by the Apex Court in its verdict given on October 24 last year. Also read, AGR dues, full evaluation to take 6 months. The top court, which was also anguished by frequently published newspaper articles on the AGR issue, said all managing directors of telecom companies will be personally responsible and will be held for contempt of court for any such future newspaper articles. A bench of Justices Arun Mishra, S.A. Nazir and M.R. Shah refused to take up the centre's plea for allowing telecom companies to pay AGR dues in 20 years, saying the application will be taken up after 2 weeks. The Bihar government has declared COVID-19 as an epidemic and issued the Bihar Epidemic Diseases COVID-19 Regulation 2020. The regulation has given legal powers to government officials to conduct mass screening of suspected patients, including forcible isolation, sealing of any geographical area and taking punitive action against those hiding symptoms of the virus, running away from isolation centers or spreading misinformation. Interactive map of confirmed coronavirus cases in India. In Bihar, a total 311 suspected cases have been reported but none has tested positive yet. There has also been no death due to the disease in the state and all schools, colleges, coaching centers, malls and cinema halls have been closed till March 31. Special screening is being done for passengers coming to the state. At the Indo-Nepal border, screening of those coming into Bihar border are being done at several places. The state government on Tuesday issued the Bihar Epidemic Diseases COVID-19 Regulation 2020 by invoking Section 2, 3 and 4 of the Epidemic Diseases Act, 1897 with the notification issued by the Health Department. Watch, COVID-19, Do's and Don'ts from the Health Ministry. Principal Secretary, Health, Sanjay Kumar said, regulation has been brought in with the objectives of providing legal cover to officials in taking appropriate measures to contain the spread of the virus and also encourage social distancing among people to check the virus. Now the district magistrates can initiate coercive action against any person considered suspected or confirmed of coronavirus if he or she refuses to take measures for prevention or treatment like home quarantine or institutional quarantine isolation, he said. He also added that under the regulation any person, institution or organization found spreading misinformation regarding COVID-19 through print, electronic or social media would be booked.